Everybody. Welcome back to If Bones Could Talk, our podcast from Palmetto Bone and Joint. I'm Dr. James Logging, joining you again today, and also have Dr. Jackie Van Dam here with me. Welcome, Jackie.
Yeah, good to see you guys again, and we're going to have a good talk today, hopefully introducing a little bit about the topic of hip pain in general, and hip arthritis will start us off.
Yeah, so we're just going to basically talk about, like Jackie said, the different causes of hip pain. Obviously, your most common cause of hip pain that most people would get likely is going to be hip arthritis. And a lot of people, ask about what exactly is arthritis and what causes it. And basically, arthritis is just a deterioration of the articular cartilage within the joint. So both of the bones and any joint in the body is coated with articular cartilage. And arthritis is just the process of the deterioration of that cartilage. So as that cartilage deteriorates, it gets roughened and uneven. That causes pain. And as it continues to wear down, it gets to a point where the bones are basically rubbing bone on bone. And that's what leads to a lot of the pain. So hip arthritis is probably one of the more common problems that you have. And we talk about treatment options for that. You can consider conservative measures before surgery, which could include injections and anti-inflammatory medicines and things like that. But ultimately, as that hip is deteriorated to that point, a hip replacement is probably going to be your best bet for hip arthritis. But hip arthritis isn't the only cause of hip pain. So there's definitely numerous other things that could contribute to hip pain. So why don't you tell us a little bit about those, Jackie?
Yeah, we were talking earlier just about often we'll see patients come in with some hip pain, and they might have an idea about what they think it is, either arthritis or they've heard somebody had bursitis or even referred pain from the low back. And so oftentimes we use either injections or our physical exam to try to see if that hip pain is coming from the joint itself, or perhaps more lateral hip pain might be coming from the hip bursa. Often Dr. Logging and some of our other doctors will do injections that can be therapeutic and help your pain, but also be diagnostic. So if Dr. Logging's thinking that, maybe you would be a candidate for hip replacement and your hip has some moderate arthritis, we might do a hip injection to make sure that that gives you some relief, as occasionally you have hip pain that's referred from your low back. Sometimes you'll have a pinched nerve there and some degenerative changes in the low back that can refer the pain down into the hip, but indeed the source of the pain is the low back.
Yep. And I think we have an image here we're going to kind of show people. So this is an MRI scan on the lower back. And you can kind of see between the two pictures, they're the same image, but the one that's illustrated in red are those herniated or protruded discs in the lower back, which will pinch a nerve and can actually refer pain into that hip. And so a lot of times we see people who have hip pain and may have these herniated discs or pinched nerves in their back, and their pain is simply hip pain. And so sometimes it can be pretty difficult to know for sure whether that pain is related to the hip or is it referred pain from the lower back. And like Dr. Van Dam mentioned, that that's where those injections can really be helpful to help us figure out whether that pain is hip related or if it's lower back or referred pain. One thing I do want to mention right now before we keep going forward, if you go on Facebook and you want to ask us a question about this topic, go on Facebook and just write in the comments section a question, and we'll try to get it answered for you during this podcast. So you do have the opportunity to ask some questions if one comes up. So just go on Facebook, ask a question, and we'll be happy to answer that for you. So I think we talked about, referred pain to the hip. We've talked about bursitis a little bit. We've talked about referred pain into the hip. So those are probably your more common problems that you get. Anything else you want to add to that, Jackie?
Yeah, I guess one thing with the hip bursitis, which is typically more that lateral hip pain, it might be worse after you've been sitting and you get up to walk around, and you might have had the pain when you slept on it at night. That lateral hip pain is something I see a bit because we don't tend to do a lot of exercises for a hip that we need to be doing as we get older. And a lot of these are hip abductor or extensor strengthening exercises that aren't always intuitive to something you're doing during the day. When we're walking, we really rely on those hip muscles to keep us upright and to, stabilize our pelvis. So it is important sometimes for us to, with the hip bursitis, refer you to some physical therapy to get those hips strong, which can really help those symptoms. We'll also do quite a bit of either injections or other modalities with therapy to get rid of that hip pain. But that hip bursitis tends to be more lateral. And I know we were talking earlier about the hip pain from the hip joint, like Dr. Logging treats a lot with the arthritis, and where that is located. Did you want to talk a little bit about where you see that hip joint pain often, or where you feel it?
Yeah, so, and that's the thing about the hip joint too, and why it can be somewhat difficult sometimes, is the hip joint can cause pain in many different areas. And so, probably I think 60% of the time, the pain is usually either growing pain in the front of the hip, and it can sometimes be lateral pain more on the outside. So sometimes it can be difficult to discern whether is it bursitis or more arthritis for the pain. And that's probably 60% of the time. And then a lot of times the pain is all posterior in the back of the hip or even into the lower back. And that's where it gets confusing because, it's hard to know, okay, when the pain's in the back or in the back of the hip, a lot of times you think, well, it's probably coming from the lower back or referred from the back, but that's not always the case. Jackie and I talking earlier, and we've seen numerous patients who, have been treated for their back, numerous injections in their back, and then the pain doesn't get better. And it's not until somebody decides to x-ray their hip that they find that the hip has got, significant problems, and that's where a lot of their pain's coming from. So
did you have that x-ray example of one of those arthritic hips?
Yep. Yeah. So this is an x-ray that we, you typically can see. If you look at the picture on, I guess, your right, if you're looking at it, it's actually the patient's left. If you see the circle of the ball and then the white line there of the socket, there is space that's between that. But if we look at the hip that's on, as you're looking at the screen, the left, but the patient's right, you can see there's no space whatsoever between those two bones. And then all of those little dark circles that you can see in the ball of the hip itself, those are what are called subchondral cysts. And so those tend to form as the two bones grind together. It actually starts to reabsorb the bone underneath, and that leads to those cyst formations. So those, will continue to enlarge with time if that's left untreated, and those cysts can eventually kind of function like a sinkhole. They'll get so big that weakens the bone, and then eventually the bone just collapses and crumbles in. And obviously that can be a pretty severely painful condition once that happens. Once the hip gets to this point, arthritis-wise, the only option to really fix it would be a hip replacement. So, when we talk about hip replacements, one thing a lot of people don't realize is there's multiple different ways you can replace a hip. So there's more than one way to skin a cat, as they say. One of the ways that I've been doing it for a long time that not a lot of people still don't do is what's called the anterior approach, meaning we come from the front part of the hip. The benefit of coming from the front is that it's a really small incision, but the big benefit is we don't cut the muscle, and so the recovery time is half that of the traditional way. So it's a lot faster recovery time. You get more normal hip function, more normal strength and motor function afterwards, versus the posterior approach, which is what most people do. Where that creates a lot of muscle damage, and so you get permanent weakness and permanent problems as a result of that. So an anterior approach is definitely the best way to go for most all patients. I do it on everybody who needs a hip replacement because I believe that everybody deserves the ability to have that approach, because it does make such a big difference with the recovery. So we're going to stop for a second and answer a question. One, hello, Ginger Riddle. Good to see you. And then Teresa asks, what if the pain runs down your arm, into your buttock, or down your legs? So when we talk about pain radiating into your arm or pain radiating into the buttock or the legs, that can be a lot of different things. And typically that is a pinched nerve that usually would cause a lot of those pains. And so that's where we would want to evaluate with an MRI to see, if it's in the arm, is there a pinched nerve running into the arm, or if it's into the buttock or down the leg, a lot of times that is a pinched nerve in the back. And so the MRI would be helpful in determining that. But like we mentioned, I've seen a lot of patients who do have pain radiating from their hip all the way down their leg. And it turns out it's actually the hip. The hip can get inflamed enough to where it can irritate those nerves.
Right.
And it can make it look like it's a pinched nerve in the back, but it's actually the hip that's causing it. So that's where it can be pretty confusing.
Right. Yeah. And I think, Teresa, that the imaging is probably going to be where you're going to need to head next to kind of sort through that, especially if it's an upper extremity and a lower extremity. I think with the arm and the leg, it would be important to image the spine and the hip too, both in the neck and the lower back if you have the arm issues.
Yeah, absolutely. So, and then the diagnostic injections, just another route to really help us figure out, where exactly that pain's coming from.
Yeah. We're looking at a lot of the comments here, and a lot of Dr. Logging's previous patients are writing in that anterior hip replacement is the way to go.
It definitely is. Terry Miller, good to see you. Hope you're doing well. And she was a patient of mine who had an anterior hip replacement and did really well with that. So I'm glad to see you on there as well. So again, any other questions, just let us know. So, we kind of talked about the hip replacement, definitely a good option, and really successful surgery. I mean, I think the success rate on that, especially with anterior approaches, I mean, nothing's 100%, but it's pretty high 90% with regard to success rate. So very successful surgery. The recovery is a lot easier to get over. And so something, if you're having that problem and determine it is hip arthritis, it's not something to be too scared of. Most patients, now they say, I wish I'd had it sooner.
Yeah. I mean, I think that's what we see the most is oftentimes people are hesitant to get evaluated and have the surgery. And then I think with hip replacements, especially your anterior approach, people are most surprised by how quick the recovery is and how easy it is.
Absolutely. So it does make a difference. But, I think, regardless of the problem, and, there are a lot of other conditions that can contribute to hip pain. Some of those are less common, but those are where, having a specialty or specialist like Dr. Van Dam or myself or any of the doctors here at Palmetto Bone and Joint, it'd be good to come in, be evaluated for that, and let us kind of determine exactly, where the problem and pain's coming from. Because like we said, I mean, sometimes even for us, it can be difficult to figure out exactly where that pain's coming from. But we've, developed a lot of tricks and techniques to help us decipher that.
Yeah, we had been talking a little bit earlier about the talk today, and the main causes of the hip pain are probably most commonly the arthritis, hip bursitis, and perhaps referred pain from the low back. But there's other things that he alluded to, like SI joint issues and piriformis issues, and there's a lot of conditions that we don't see as commonly that we can kind of help you work through, especially if you've had a little bit of a workup but aren't getting the answers you want as to what the pain generator is. So
yep, absolutely. So regardless, if you're experiencing any hip pain or problems, you don't have to suffer with that. Come in, make an appointment here at Palmetto Bone and Joint. I know Dr. Van Dam or myself would be happy to take a look at you, help you figure out exactly what the problem is, and determine what's the best treatment options for you. And that doesn't always mean that it's going to be surgery. I mean, it may be injections or medications or therapy. And sometimes surgery is the answer, but not all the time. I mean, we can a lot of times find solutions that may not require surgery. So, all right. So that's our first topic for today, and we're going to have another podcast coming up soon. So if you've enjoyed it, we encourage you to tune in, and we'll try to announce when we're going to have that podcast. But again, in the future, if you see our podcast and you want to ask us a question, just tune in, on Facebook, put in the comments, what your question is, and we'll try to get it answered. And we want to try to make this an educational, podcast for everybody, and hopefully answer some questions for you as well that you may have. But if you're having hip pain, come on in. We'll be happy to take care of you.
All right. Sounds good.
All right.
We'll see you next time.
All right. Thank you so much. Take care, everybody.